Hello everybody, this is Dr. Seaton with the Chiropractic Place. Today's video, we're going to be talking about some health and wellness topics today. One of those is what's called all-cause mortality. This is something that researchers look at when they're looking at contributing factors that can cause you increased risks compared to other people for death. And this is a great measure when we're looking at kind of general ideas for health, like general understanding of health and factors that can really affect all different causes of death related to you. So these are some things that I wanted to point out to my patients in the ongoing effort to help people stay healthy, to stay fit as part of an active chiropractic lifestyle. So we know, and most people already accept, that smoking does cause increased risks for a number of different health problems. So related to all-cause mortality, smoking causes a 40% increase in your overall risk of death. So when you take a smoker and you compare it to a non-smoker, the smoker has a 40% increase in chance of dying from all causes of death at that particular moment versus a non-smoker. So there is increased risk across the board with your health to smoking. With high blood pressure, if you have high blood pressure, it's a 25% increased risk of all causes of death versus people who don't have high blood pressure. So that's how all-cause mortality works. But very few people understand this one, and this is really interesting. This comes from a Dr. Peter Attia. He's an MD. He is a medical doctor that really does focus on lifestyle and longevity. He preaches this and practices this with his patients. A very well-known guy. You can look up his stuff at peterattiamd.com. Really good doctor and has a lot of cool things to say. But this is something that Dr. Peter talked about that was very fascinating to me, which I think is very important for patients to understand. When they're looking at people with low muscle mass and high muscle mass, the differences between that caused up to 200% increase in overall all-cause mortality. 200% increase, meaning the people who had less muscle mass, less strength, those people had a tremendous increase in risk of death to them versus people who were maintaining their strength and maintaining their muscle mass. That really kind of blew my mind when I heard that fact, so I wanted to make sure I shared that so people really understand just how vital it is for us to train and to exercise on a regular basis. Because the other thing that this can help with is as we're training and exercising, we know the effect that has here, right? We know exercise helps lower blood pressure. We know people who exercise regularly on a day-to-day basis and they do it continuously, there's something like a 70+% decrease in cardiovascular risk to them. So that's a tremendous improvement in their health. But not to mention, people who are doing this, they also lower this risk. And people who are training regularly, they're far less likely to engage in things that are unhealthy for them, like smoking or overuse of alcohol and things like that. So just a really cool thing that I wanted to share with my patients today. Those of you who are under chiropractic care, who have been coming in regularly, you understand that Dr. Seaton wants you guys to be strong. We want you to be healthy. We want you to exercise. We want you to do these things because we know from the science that this really does matter. It really has a big impact on your health, and it will affect you in all these other areas, including your chiropractic care, the effectiveness of your chiropractic care. My patients who exercise consistently, eat properly, do those things, get far better results than patients that don't, because all of these other factors of health really can influence the success of your chiropractic care. I'm Dr. Seaton with the Chiropractic Place.